Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
A new collaboration between physicians at Mayo Clinic's Florida campus and a team of Georgia Tech students is looking to find new ways to take innovative ideas from just a concept all the way to the clinical setting.
The Mayo Clinic's Convergence Science Program pairs Georgia Tech's engineering expertise with Mayo physicians' ideas to tackle a clinical problem in need of a solution. Two minds are better than one, for sure. Joining us on the phone from Jacksonville, Florida to discuss the Convergence Science Program is the Associate Medical Director of Mayo Clinic Ventures, Dr. Charles Bruce. It's nice to meet you, Dr. Bruce. Welcome to the program.
Oh, thank you very much, Tracy. Thank you, Tom.
Dr. Bruce, good to talk to you. We miss you up here, but I suspect the weather's a little better in Florida than in Minnesota right now, at least right now. So what a great idea, this Convergent Science Program, which I hadn't heard about before. So who came up with this?
Well, I have to say this has been a group effort down here. And when you look at convergent science, it's really the ability to converge people from different disciplines and with different skill sets to develop really good solutions for our patients and bring them to our patients as quickly as possible. And it really was born out of a necessity and need because although physicians are very good at being at the coalface of patient care and identifying the problems that we encounter as healthcare providers and our patients experience, we may come up with the ideas, but to be able to bring those ideas to reality and to be able to bring them to benefit our patients as soon as possible, we really do need engineering support. And so it really was this idea that if we could link clinicians, inventors, researchers with engineers, and certainly talented engineers, that could help us bring these ideas to reality, this would be a very fruitful relationship. And indeed, that's what we've been able to achieve through the vision as well as the generosity of a Mayo benefactor, Larry Wong, who also happens to be a Georgia Tech alum.
So what was the problem that you identified that you said to yourself or your group said, we really could have, if we had some engineers, I think they could help us?
Well, it really spans the spectrum of issues that we face. What's interesting is a statistic that most people don't know is that we have about 600 ideas that are brought to the Mayo enterprise by our staff every year. And what's really remarkable is, so it's just about 2 a day. And what's really remarkable is that 42% of these ideas actually end up turning into some commercial opportunity that benefits our patients, which is really a remarkable success rate.
Wow.
But one of the big gaps that we have, as I mentioned earlier, is being able to link these ideas with an engineering group who can then bring these ideas and prototype them so that we can test them, iterate them, and get them as a reliable clinical tool. So in fact, the first cohort of 5 undergraduate students from Georgia Tech, what we did was we solicited ideas from our campus here in Florida. We had about 20 applications. We whittled them down to about 12 because we also need to understand that this project needs to be able to have some sort of deliverable within a 16-week time frame. And that narrowed them down to 12. We presented these 12 ideas to these top 5 undergraduate Georgia Tech students who worked as a team, and they then selected the particular project that they felt they could make the most impact with. And this particular project, the first one that they embarked on, was a very novel idea of how to insert a needle into the spinal canal without the use of traditional imaging guidance like fluoroscopy.
Really?
And they came up with a solution?
Well, it was a team effort, as I mentioned. So they worked with 3 very talented inventors. One was actually an electrophysiologist, so a cardiologist who works with electrical wiring in the heart, and then another 2 interventional radiologists who are very familiar with doing these procedures, but using X-ray guidance. And so these 3 Mayo clinicians then worked with this group of 5 Georgia Tech students to come up with this very novel solution of using electrical impedance as a way to determine when the needle had actually entered into the spinal canal.
Wow. So instead of using imaging, you what we would call a blind shot previously, you're able to know because of the help that they gave you when the needle is actually in the spinal cord. And this would be for somebody who needed a spinal tap or a spinal anesthetic, for example.
Yes, and in fact, the number of people actually benefiting from this kind of technology is actually even beyond that. So, in mothers who are delivering babies, they have to undergo epidural anesthesia,
Right.
And so this very same procedure needs to be performed in expectant mothers, and the challenge is that when it is done in sort of blindly, as it were, using sort of very crude landmarks. Sometimes it can be challenging, even in the most expert of hands, to get into the right space. And so this is a method to do that more safely and more expeditiously.
And what's it based on, did you say?
It works on a bioimpedance principle. So it's basically able to determine the difference in tissue characteristics, so that when the needle advances through the tissue and gets into the space, there's a difference in the bioimpedance characteristics of the tissue.
That's amazing.
Unbelievable. Yeah.
And what's really remarkable, honestly, is that this group was so successful that they, as soon as they finished their capstone undergraduate project, they went on to start a startup, and the technology is now called Neuralign. So they are fired up, and this is really remarkable. It's
really
just
is
a tremendous success story out of the gate.
Yeah. So what's next?
Well, they were the first cohort. The second cohort has just actually graduated, and they tackled a different problem with one of our colleagues, who's a urologic surgeon, who also happens, interestingly, to be a Georgia Tech alum, Dr. Raymond Pack. And so what they tackled was a urethral bladder anastomosis. So it turns out that there are many men who undergo prostate surgery every year, and one of the most challenging aspects to the prostate surgery, once the prostate has been removed, is reanastomosing or connecting the ureter with the bladder.
Yeah, the ureter is the tube that goes from the kidney down to the bladder.
Yeah, exactly. And so it's a small, delicate structure that needs obviously to remain open. And so this group of Georgia Tech students decided to figure out if they could build a foolproof, automated way of connecting this tiny tube to the bladder without it kinking and sealing it successfully. And in fact, they were able to do that. And when they had their apparently the Georgia Tech students have a competition at the end of their semester, and they actually took first place. So they're busy working now on miniaturizing this solution so that it can be brought to use in patients.
Well, this is at the Jacksonville, Florida campus, and
that's correct.
Mayo Clinic, of course, is in Arizona and in Minnesota as well. Do you know if the Convergence Science Program is going to spread to the other campus?
I think it is. I think that this has been such a successful opportunity that, and obviously there's a lot of activity in innovation around the enterprise now. I mean, with Discovery Square and in Rochester, and with the very unique and enviable relationship of Arizona State University and Mayo Clinic in Arizona. These kinds of opportunities, I think, are going to continue to grow.
Fascinating stuff.
Yes.
We've been talking about Mayo Clinic's Convergence Science Program with the Associate Medical Director of Mayo Clinic Ventures, Dr. Charles Bruce, joining us on the phone from Jacksonville. Dr. Bruce, thanks so much for being with us.
Well, thank you very much, Tom. Thank you, Tracy, very much for this opportunity.
And that's our program for this week.